of the COVID task force at Piedmont Healthcare here in Atlanta. Thank you so much for being with us.
It's a pleasure.
Okay, 3/4 of Americans do not fear getting COVID this holiday season. Are there reasons to be less afraid this year than in previous years?
You know, what we've seen is just a general ambivalence as we've moved into this season. And we were hoping that this would be more of a transitional season where we would actually get out of COVID. But because of ambivalence, because of confusing messaging, and there's a polarization politically, as well as kind of a been there, done that attitude, that we really don't see the uptake that we would like to have seen. We are at maybe about 14% of people have gotten this updated vaccine to date. But make no mistake, we never were at a great, robust response. At our peak variants, we were just under 70% nationwide of people who had received both vaccines. I know you have higher numbers with regard to people who are vaccinated, but those are people who received one dose of the original 2-dose series. And now I'm talking about people who actually completed the series and got 2 doses. That was less than 70%.
So for the people who say that, you know, these 3/4 of Americans say they're not afraid of getting it, maybe, and they don't have a follow-up here, but I've got the vaccine. I know that the vaccine will keep me out of a hospital and there isn't the fear of death. Is that sensible now that they say, maybe I've had COVID? It's not as bad as I thought it would have been in 2020 or 2021.
So one thing that we know is that the issue with COVID, as opposed to other viruses like measles and mumps, is that as it spreads from person to person, it mutates. So we're not able to get that herd immunity. We certainly had an opportunity early on in the pandemic to reach herd immunity, but we couldn't get enough people vaccinated within that time frame to reach that. The other concern is the spillover effect that we see in our children with regard to vaccine uptake of all of our vaccines. So for the first time since we've been tracking this with the CDC, we see that children have filed more than a 3% exemption out of getting these vaccines. And we need to have at least 95% of the population vaccinated to continue to have herd immunity. And even more alarming, there are 10 states in the United States that have greater than that 5%. So already are outside of what we deem to be safe for herd immunity for measles. And there are 40 states that all have an increase. So you can see with this spillover effect from COVID over to vaccinations in general and parents' attitudes towards them.
Yeah, so make no mistake that as the survey found, more than half of respondents who say they probably or definitely would not get the updated shot has a public health impact for the rest of us. That's how we got Delta, that's how we got Omicron and the mutations after that. Let's talk about the flu, and we're seeing an uptick in activity. There's a high activity, and I looked at the map this morning. Louisiana, Mississippi, Alabama, Georgia, South Carolina, the highest across the country. A 4% increase week to week. More than getting a flu shot, what, as we get back into airports and family gatherings, should we do, if anything, differently?
So let's talk about masks for a moment. And masks, you know, maybe have gotten a bad rap, but something to think about masks, whether you're pro-mask or anti-mask. Masks scientifically have definitely been shown to decrease respiratory viruses. We are Homo sapiens, human beings, so we live by breathing in oxygen. Masks are a barrier. The other thing to think about with these cold weather viruses like the flu is that masks keep the temperature of your nose elevated enough such that the receptacles in your nose can work and grab these viruses and bacteria that come in. It reduces your risk of infection. Every 9 degrees Fahrenheit that your nose drops in temperature, you kill off these vesicles that actually are there to sequester viruses and remove bacteria as it moves into your nose. And so a mask actually keeps the temperature up as well, decreases your risk of getting ill.
I don't know if y'all saw the light bulb over my head when you said that, but the idea that there's more blood and it's warmer, that my nose can do its job.
That's right.
For years when people have been saying, oh, I got a cold because the temperature dropped, I'm like, you don't get a cold from the temperature, but if your nose is colder,
that's right,
the vesicles,
That's right.
as they are,
That's right.
can't filter out what's
There I
coming
go.
in.
Grandma was always right.
Always right.
Always right.
Dr. Jane Morgan, thank you so much.
You're welcome.
All right.
Mama was right too. Still ahead.